And medical marijuana in Cherokee is a step closer.
News 13's Rex Hodge reports on the key vote taken by Tribal Council today and the work that's still needed to make it a reality.
Tribal Council votes in favor of medicinal marijuana, but there's still a lot of work to be done, including the establishment of a local board and advisory commission.
I believe it was 8-4.
Principal Chief Richard Sneed says with a vote comes the authority to start a medical marijuana program in Cherokee.
The first tribe east of the Mississippi, as far as I know, to be engaging in medicinal cannabis programs. Next step, we'll have to seat a board for regulatory purposes. And then once that's done, then we start looking at the cultivation process.
It's surreal right now. You know,
Cherokee Governmental Affairs Liaison Jeremy Wilson and Agriculture Secretary Joey Owl have worked on the issue for years. He says the advisory commission will include key Cherokee leaders who will work with the control board.
3 are required to be enrolled members, but all 5 can be enrolled members. So the operations of the industry will operate under our business arm, Wakadua LLC, and the regulatory part will be happening under the tribe with the control board.
Wilson says individuals will need to obtain a profile of their health record showing a qualifying condition for medical cannabis.
So they would subject that to the control board, who would deem them approved or not approved for their purpose of receiving medical marijuana. You are still only subject to 1 ounce of possession per day. You cannot smoke it in public.
Medical marijuana laws in North Carolina are in flux, and Cherokee has sovereign nation status, seeing an opportunity.
We want to make sure this is done right, because we are going to be under a microscope. We know that, just because of the unique situation it is here with our sovereignty versus what's the law is in within the state.
This plays into sort of the Cherokee culture, does it not? I mean, plants have been part of medicine for a long time.
Indeed. I think that's probably why there's such widespread support in the communities.
Wilson says the decision is precedent setting.
It gives us an opportunity to showcase in North Carolina how it can be done and be done efficiently and effectively.
Tribal leaders also say medicinal marijuana would also establish a significant additional revenue stream.
During an emergency, the Asheville Fire Chief believes it's taking too long to show up in several neighborhoods.
The Asheville City Council recently approved a solution that's been years in the making. News 13's Andrew James shows us the plans for a new fire station in North Asheville.
During an emergency, seconds can be the difference between life and death.
The outcomes in that area were far less favorable than in other parts of the city.
Asheville Fire Chief Scott Burnett is talking about response times in Stumptown, Montford, 5 Points, Klondike, and Richmond Hill. The department's goal is for fire crews to arrive on scene in 5 minutes or less from the time they are dispatched.
Right now, we're doing that less than half the time. About 45% of the 911 calls that come from those neighborhoods and communities, we're getting there after that 5-minute mark.
Chief Burnett says the solution is to build a new public safety building here at the intersection of Broadway and Montclair. The Asheville City Council approved the construction contract last week. The price tag is close to $11 million. What do you say to people who are concerned when they see the dollar amount associated with this project?
This fire station is built for 50 years, and so it does have an expensive price tag. However, this fire station will be serving those communities and neighborhoods for many, many years.
Plans for the project show it's more than a fire station. The 21,831 square foot 3-story building will house the new Fire Station 13, a police substation, an emergency operations center, and a community meeting room. Planning documents from the city show the money is coming from previously approved capital project funds. A city spokesperson says the contract is now in the routing and approval process. Andrew James, News 13.
News in Asheville are having to shift gears again as COVID cases rise. This week, the Harlem Globetrotters postponed their stop in Asheville to next year.
News 13's Caitlin Pinter talked with venue leaders about the changes that we could see going forward. She joins us now live from the Asheville Tourist Game tonight.
Yeah, 3,000 people are expected here tonight, and the tourist owner says he, like other venue leaders, is watching COVID numbers very closely. We go again.
We're all exhausted.
Venue leaders in Asheville are bracing themselves for what's to come as the pandemic threatens their livelihoods for a second time.
We have to keep our staff working. We have to keep our club open.
Rabbit Rabbit is holding its second big concert of the year this week. They're expecting between 1,600 and 1,800 people, which is around half capacity. Staff is now required to be masked and vaccinated. The venue's leaders say if numbers get worse, more protocols could be put in place.
We are starting to see really strict COVID riders from bands, either requiring everyone working to be vaccinated or requiring the audience to be masked, even if we haven't made that policy across the board yet.
The Asheville tourists have been at 100% capacity. Masks are required for unvaccinated staff. Owner Brian DeWine says they're lucky to be outside. They have 16 home games left.
There is some concern, and we're definitely watching it, and we're hoping that this does get straightened out, more people do get vaccinated.
Leaders at Harris Cherokee Center Asheville say the Harlem Globetrotters got rescheduled for a variety of reasons, including COVID. This weekend, they are preparing for the big widespread panic concert. You will have to show proof of vaccination or a negative COVID test. They will also be rapid testing on site. Staff recommend getting there at noon to check in early and avoid lines. And Asheville tourist owner Brian DeWine says even though they are at full capacity, they usually don't get to that point, so there is room for people to space out. He also says he has noticed more people wearing masks at the recent games. Live in Asheville, Caitlin Penter, News 13.